About 12 million Americans currently carry the gene for a condition that causes the same disease that affects more than 30,000 children and young adults in the US. Cystic fibrosis is an inherited disorder, and it disrupts the normal functions of the epithelial cells, the cells that line the passageways of many of the most important organs, including the lungs, the respiratory system, the liver, the kidney, the skin, and the reproductive system. People with cystic fibrosis have a certain defective gene that impairs the epithelial cell function, causing them to experience a buildup of sticky mucus inside the body, often leading to lung damage and chronic coughs. This defect, in turn, affects how the cystic fibrosis patients breathe and filter air, how they digest food, and how they absorb nutrients in the digestive tract. Because epithelial cells have many important roles in the lungs, the sweat glands of the skin, and the digestive system, cystic fibrosis symptoms can occur throughout the body, and they can become severe. Cystic fibrosis is a serious, lifelong disease, and it needs to be properly managed throughout a patient's lifetime. According to the Cystic Fibrosis Foundation, currently cystic fibrosis is considered to be incurable. However, certain dietary interventions, supplements, digestive enzymes, and lifestyle habits can help to manage the symptoms. Fortunately, over the past decade, cystic fibrosis treatment approaches have come a long way. Most people with cystic fibrosis now live into their 20s and their 30s, and some even longer into their 40s and their 50s. Research shows early diagnosis of the cystic fibrosis can help to prevent the complications and certain developmental problems, helping to improve a patient's quality of life. Cystic fibrosis is diagnosed most often in unborn babies, newborns, or young children by performing genetic testing. Doctors can now test for cystic fibrosis during pregnancy, which is especially common in children who are at high risk. In newborns or children, a sweat test is now the most common means of making a cystic fibrosis diagnosis. This is conducted by testing a sample of sweat from the skin for the level of chloride. Aside from a sweat test, a chest X-ray, blood tests, nutritional status tests, bacterial tests, and pulmonary function tests to measure the breathing can also be performed. Early diagnosis of cystic fibrosis can help to manage the symptoms and the complications before they worsen, such as dehydration and diarrhea, and these contribute to the weight loss. Doctors can help to clear the lungs of the mucus. They can help to prevent infections, and they can get the patient started on a diet that will prevent the nutrient deficiencies. Digestive enzymes and supplements can also help with healthy development and weight gain. Young cystic fibrosis patients who begin a diet with high nutrient foods, supplements, and digestive enzymes are more likely to have stronger metabolism, to gain weight normally, and to avoid deadly infections. Diet plays an important role in cystic fibrosis management because lung infections and disease progress more slowly among the children who are growing well and getting enough vitamins, minerals, probiotics, and antioxidants. Many doctors and nutritionists working with cystic fibrosis patients recommend a high-fat, high-calorie diet to reduce the risk of malnutrition. Although enzymes are often needed to boost the absorption of fat and fat-soluble vitamins. Junk food and processed food might be high in calories and fat, especially trans fat or omega-6 fatty acids found in the refined vegetable oils like safflower, sunflower, corn, and sesame, but they're usually not helpful for lowering the inflammation and for preventing the lung damage. Therefore, they're not recommended for cystic fibrosis patients. Some of the beneficial nutrients that people with cystic fibrosis are most likely low in include vitamin K, D, A, and E. Some people with cystic fibrosis may also need to add more salt to their diet to prevent dehydration. Omega-3 fatty acids can be beneficial for lowering the inflammation. This is found in wild-caught fish like Alaskan salmon, sardines, and halibut. Pancreatic enzymes are also commonly given to help digest the food or the calories better. High-quality multivitamins and antioxidants can help to prevent inflammation, susceptibility to infections and lung damage. And probiotic supplements are also helpful for improving digestive function. Eating anti-inflammatory fats, including monounsaturated fats like extra virgin olive oil, avocado and virgin coconut oil, is a good way to increase the calorie intake. Nuts and seeds such as almonds, chia seeds, flax, walnuts and hemp seeds are also good choices for this purpose, as are naturally fattier meats like grass-fed beef and lamb. Unrefined carbohydrates can help to provide dense calories and energy, especially when combined with fat, but it's best to eat unprocessed, low glycemic kinds, such as ancient grains, starchy vegetables and fruit. Serrapeptase is an enzyme that's isolated from bacteria found in silkworms. It's been used for years in Japan and Europe for reducing inflammation and pain due to surgery, trauma and other inflammatory conditions. In the US, serrapeptase is classified as a dietary supplement. It's used for painful conditions including back pain, osteoarthritis, rheumatoid arthritis, osteoporosis, fibromyalgia, carpal tunnel syndrome, migraine headache and tension headache. The serrapeptase will reduce any inflammation in the area and break down the scar tissue without affecting the healthy tissue. It has the added benefit of improving wound healing in general by clearing old or damaged tissue, including blood clots, mucus, cysts, arterial plaque and fibrosis. Using serrapeptase for treating chronic lung conditions where the sputum production is a problem, for example in cystic fibrosis, leads to an improved lifestyle. Cystic fibrosis treatments today are generally aimed at improving the quality of life, helping to boost the nutrient intake and the absorption, and improving the breathing and the lung capabilities. The use of non-medication pulmonary therapy treatments to maintain the lung function is very common, and it can be life-saving. Devices such as a bronchodilator can help to relax the muscles in the airways of the lungs, to help to cough up mucus and to prevent inflammation from worsening. Using certain inhalants and bronchodilators can help to restore the breathing and to keep infection away, as can the use of a device called oscillatory positive expiratory pressure, which increases the airflow to the lungs through the use of vibrations to help to break up the mucus. Research shows that approximately 50% of patients with cystic fibrosis have some degree of bronchial lability or asthma, which a bronchodilator can improve by increasing the clearance of the secretion from the chest. Bronchodilators are sometimes used in combination with other therapies like physical therapy or anti-mucus medications and salt solutions to expel the phlegm and offer even more relief. Other natural approaches to helping cystic fibrosis patients breathe more easily can include breathing exercises, physical therapy and cupping therapy. These techniques require no medications or antibiotics, and they help to dislodge mucus in the chest, the airways and elsewhere, which can limit the breathing and decrease the quality of life. Throughout the years, there have been mixed opinions on whether or not physical therapy can be effective for lowering cystic fibrosis symptoms. One meta-analysis published in the American Journal of Respiratory and Critical Care Medicine looked at several different leading approaches of clearing bronchial secretions in the treatment of patients with cystic fibrosis. These approaches include positive expiratory pressure mask, forced expiratory technique, exercise, autogenic drainage, and standardized physical therapy using vibrations, drainage, and percussion. They found that physical therapy worked very well in the majority of patients, especially when it was used in combination with other approaches like gentle, appropriate exercise. Over 65 relevant trials and 8 review articles were included in the meta-analysis, comparing the independent techniques, and it was found that standard physical therapy resulted in significantly greater sputum expectoration than no treatment or any other single treatment. Physical therapy in combination with exercise suited for the patient was associated with a statistically significant increase in the quality of life and lower cystic fibrosis symptoms. The disease is most common in Caucasians, while Asian Americans are the least likely to have cystic fibrosis. In the US, about 1 out of every 3,600 Caucasian children is born with cystic fibrosis. The defected gene that's responsible for causing the cystic fibrosis is found on chromosome number 7. It takes 2 copies of the cystic fibrosis gene, one inherited from each parent, for someone to develop the cystic fibrosis. When 2 cystic fibrosis carriers have a child, there's a 1 in 4 chance that that child will have cystic fibrosis. It can also be carried in people who don't develop the disease if they inherit only one of the genes. The carrier parent can then pass on the disease to their child. An estimate show about 12 million Americans are currently cystic fibrosis carriers. 85% of people with cystic fibrosis are diagnosed as infants. Today, earlier detection, including during pregnancy, is helping doctors to manage the disease as early as possible. Cystic fibrosis affects how certain proteins work inside the epithelial cells of the mucous glands. Most people think of the epithelial cells in terms of the skin, since they do, in fact, help us to sweat, so that we can regulate our body temperature. But these important cells also have the responsibility of controlling the way that chloride, a part of natural salts, passes across the cell membranes into other parts of the body. Epithelial cells balance the ratio of salt to water, forming important fluids, digestive juices, and mucus that helps to break down the food and to prevent viruses and infections. With cystic fibrosis, thick mucus begins to accumulate and it can start to block the airways in the lungs, contributing to recurring infections, since germs are more likely to get trapped inside the body. In addition to this mucus damaging the lungs and lowering the immunity, it's also capable of affecting the digestive system, especially the pancreas, the kidneys, the intestines, and the liver. Mucus can start to slow down the production of important digestive enzymes and juices that are normally secreted by the pancreas, and this leads to trouble properly absorbing nutrients inside the intestines and sometimes unhealthy weight loss. People with cystic fibrosis suffer from symptoms including nasal congestion, lung damage, chronic coughs, and asthma-like symptoms, coughs that produce thick, heavy, discoloured mucus, repeated sinus and lung infections such as bronchitis and pneumonia, which is one of the leading causes of a shortened lifespan, trouble breathing or wheezing even when at rest, nutrient deficiencies, especially of the fat-soluble vitamins A, D, E, and K, developmental problems in infants and children, and unintentional, sometimes dangerous, weight loss, diarrhea, dehydration, and electrolyte imbalance, oily, bulky stools caused by undigested fat and protein accumulating in the stool, digestive problems such as intestinal gas, swollen belly, chronic diarrhea, and abdominal pain, salty frosting on the skin caused from epithelial cells not being able to balance the salt and the water, chronic fatigue, long-term complications and illnesses that can develop from cystic fibrosis include sinusitis, pancreatitis, intestinal blockage, nasal blockage, collapsed lung or pneumothorax, rectal prolapse, gallstones, diabetes, and low bone density. Since many cases of cystic fibrosis are diagnosed in infants or very young children, developmental problems and life-threatening infections are some of the biggest concerns. Many newborns with cystic fibrosis don't gain the weight as expected, since mucus prevents the pancreatic digestive enzymes from entering the intestines and breaking down the fats and proteins properly. The lungs are especially susceptible to the recurring infections such as bronchitis or pneumonia, sometimes which babies or young children aren't capable of fighting off. Cystic fibrosis is an inherited disorder caused by a faulty gene that directs how the body produces a type of protein known as cystic fibrosis transmembrane conductance regulator, or CFTR. This is found in the body's epithelial cells, which are the most abundant in the lungs, digestive tract, sweat gland, and genito-urinary system, the organ systems of the reproductive organs and the urinary system. CFTR proteins help the epithelial cells to regulate the levels of chloride found in salt, sodium chloride. So when they're not working properly, the consistency of the mucus and other fluid levels becomes altered in a dangerous way. The delicate balance of salt and water that's needed to maintain a thin coating of the mucus inside the organs is shifted, and as a result, a thicker than usual mucus forms that can heavily coat the inside of the lungs and the passageways. Mucus inside the lungs has an important role of trapping and helping to remove germs such as bacteria, viruses, and fungi. In people with cystic fibrosis, mucus is normally thin and fluid-like, which allows it to be easily cleared from the respiratory system, carrying with it germs and waste, which are then cleared out of the lungs. However, when someone has cystic fibrosis, sticky mucus stays lodged in the passageways of the lungs, unable to remove the potentially dangerous germs. Cystic fibrosis causes the most damage to the lungs, but it also impairs normal digestion. In the pancreas and the intestines, thick mucus can block the way that important enzymes work, changing how the food is digested and how nutrients are absorbed. Many people with cystic fibrosis have a hard time eating and digesting food normally, especially children who are susceptible to slow development, nutrient deficiencies, and low weight gain. Even if cystic fibrosis doesn't change someone's appetite and food intake, it can still block some nutrients from being absorbed. Instead of simply treating the cystic fibrosis symptoms, new approaches are looking to target the underlying genetic cause. Several new treatments are being developed for cystic fibrosis that offer a lot of hope in the future. One treatment that's already been used successfully in over 100 cystic fibrosis patients in the US is an inhaled spray containing normal copies of the defective cystic fibrosis gene, which can correct the faulty copy in the lungs and improve how the mucus is made. Another similar approach is protein repair therapy, which also corrects how the defective cystic fibrosis protein works and how it lowers the accumulation of the sticky mucus in the digestive tract and the airways. Cystic fibrosis affects more than 30,000 children and adults in the US. When two cystic fibrosis carriers have a child, there's a 1 in 4 chance that the child will have cystic fibrosis. Cystic fibrosis can also be carried in people who don't develop the disease if they inherit only one cystic fibrosis gene. The carrier parent can then pass on the disease to their child. And estimates show about 12 million Americans are currently cystic fibrosis carriers. Most people with cystic fibrosis now live into their 20s and their 30s, and some even longer into their 40s and 50s. Research shows early diagnosis of cystic fibrosis can help to prevent the complications and certain developmental problems, helping to improve a patient's quality of life. The best way to naturally manage cystic fibrosis includes early diagnosis and care, dietary intervention to prevent deficiencies, help with proper lung function and breathing, and physical therapy and exercise. For more information on herbs, supplements, and natural treatment plans, check out my website.